Hello, everyone. Thank you so much for joining me. My name is Dr. Princess Fumi Hancock. I am a certified, board-certified psychiatric mental health doctor of nurse practice with group of clinics, pobpsychiatry, otherwise called Pool of Bethesda Psychiatry in Arizona. I'm also a best-selling author and a TED Talk speaker. So today I wanted to share something because I just had a conversation over an interview that I had on podcast. By the way, thank you to Hilary Topper for that interview. It was a great interview, but it also prompted me to do this video. And what we talked a little bit about conversion disorder. And I think that I've already spoken a little bit about that in one of my videos. So this might just be an expanded version of that video that I did. So I talked about conversion disorder because right now, as the country, United States of America, and some parts of the world is opening up, right? Kids are being expected to prepare to go back to on-ground schooling, so that many of them are dealing with anxiety. Some of them are dealing with depression. Some are dealing with panic disorders and all kind of stuff, right? But majority of the 1 in 3, right? 1 in 3 to 4 kids that come my way do tell me that they are suffering from suicidal thoughts and suicidal ideation. Not necessarily want to do the, like go ahead and commit it, right? Or try it. While some of them still do go ahead and try that suicidal attempt, but many of them are dealing with racing thoughts. They're just dealing with all kinds of stuff right now. So that you might have a kid that is all smiling acting as if nothing is wrong. But if you sat them down, their stomach is like churning in a big way. And the thing is, this doesn't pertain to kids alone or teenagers alone. It also pertains to adults that have been working from home and now they've been told, oh, voila, show up at work tomorrow, show up at work in 2 days or 3 days. And so there's all these controversies out there saying, well, people don't want to go back to work, particularly in the restaurant industry where I know a lot of my patients come from that industry, and I'm yet to see one that says, I don't want to go to work because I have unemployment, and which is not true. Many of them do not want to go back because they don't want to be assaulted by angry mobs or angry patrons, which we know is going on right now. We have an instant where about a few days ago, we watched on the news where some people were actually literally assaulting an air hostess. Okay, so this is actually happening. And so because of that, we have conversion disorder. And I want to talk a little bit about conversion disorder. So people will ask, what is conversion disorder, right? Convert, right? That word convert, which means you're changing something, taking something from one state to the other, moving from one state to the other, right? Conversion, you're converting something. And so conversion is a mental. People would say, well, because the person is manifesting physical, is this a physical thing that I need to take my child to a primary care doctor, or do I take my child, or do myself, who is feeling it, an adult, go to a psychiatric mental health, or do I go to a physician? Now, there's nothing wrong with going to a physician, but the truth is conversion disorder is a mental condition. Let me say that again. Conversion disorder is a mental all right, a mental condition in which a person might have sudden blindness that all of a sudden they can't see, right? They might be paralyzed all of a sudden. There might be other nervous system symptoms that they might be going through, right? So that now, what is peculiar about this is that they have all these symptoms: weakness, paralysis, abnormal movements such as tremors or difficulty walking, loss of balance at times, difficulty swallowing at times, or feeling kind of like, what kind of lump is this in my throat? right? Seizures is a very big one. All of a sudden they can fall, boom, and go into a seizure, and they never had history of seizures before, right? Episodes of shakiness and loss of consciousness at times. Then you also have some episodes where they are unresponsive. I've actually witnessed a lot with adults where they fall to the ground, and if you do not know its conversion, you'll be swept away and say, wow, this is an actual seizure, right? So that it's important for us to know this. Any signs and symptoms that I've discussed, that you took that person to a primary care doctor, they ran all the gamuts of tests, and they cannot find the connection, then that's mental. Let me sit on that for a second. So if somebody is going through seizure and they go back to a physician, and the physician does all the tests, the normal tests that they need to do for seizure, and they cannot find any medical connection to that, that is called a conversion. That's the possibility that that thing is a conversion, right? Is a conversion disorder, right? So how do you get this? How do you get this? It is almost always triggered by upsetting situations or stress. And how many of you know that a lot of us are stressed, incredibly stressed with all this COVID? You know, you don't know if you're going to get it. You don't know if you got it. You don't know if your parent got it, so you can't visit your parent, you know. So all of these things, right? And then you also have kids on top of it. They are demanding, you know, that they have to do their school online that they're not used to doing. Some of them are not used to doing. Then on top of that, they have all these assignments that they have to finish through the end of the year. All of this, you know, add to their emotional stress. And so the mind, right, the brain wants to find a way of coping with this stress. And because of that, conversion disorder occurs, because our brain is looking for ways, right, to cope, right? Our brain is looking for ways to cope. All right. So does this last long? Well, some usually last like days, others last for weeks, and some is just intermittent, right? As soon as the brain is being threatened by a stress, boom, they go straight into that, right? As soon as that, it could be days, it could be weeks, it just could be intermittently. All right. So anytime that you're stressed, anytime that you're overly stressed, they tend to go into conversion because of that stress. Because of that stress. So it's very, very important that we distress ourselves. It's very important that we distress our children, right, to ensure that our children are not overly stressed out. All right. So here's the deal. Is this treatable? Is this treatable? Can we, you know, that's another question that I often hear from parents. Can we treat this? Can we treat this? And my answer is absolutely yes, it can be treated. Now, there's something called CBT, which is cognitive behavioral therapy, where you take irrational thinking and you turn it to rational thinking. So CBT is a very good way that a lot of our therapists or psychotherapists do treat this. So you can treat it, but for me as a board certified psychiatric mental doctor of practice, I really do believe in the combination of medication and psychotherapy. I think, as I often say to my patients, that the medication will correct what's going on in the brain, while the psychotherapy maintains what's being corrected, if that makes sense, right? Okay, so when we talk about that, it's then important that, number one, we help our children to live a less stress-free life, right? People would often say, well, they're faking it because, you know, okay, so I have the patient that every week the ambulance is called and the ambulance takes her to the ER. And so now they when they hear that thing, They know the ambulance goes there, stays with her for a while, and then takes her right back. So now people think that she's faking it. Let me debunk it for it. It is not fake to them. All right. They literally feel that seizure, they experience it, and it's not fake. All right. But here is how we can help them. We can help them to distress themselves. It's very important that kids are allowed, even adults, allowed to go out. Vitamin D is a very good, natural vitamin D is very good for depression, right? So that when you have sun, that it helps you to kind of overcome a little bit of the depression that might be going on. Then breathing exercises for those who might be going through anxiety and depression, anxiety and panic disorder, breathing exercises. Oh, you wake up in the morning, instead of just dashing off of the bed, just stay there for a little bit and just do 5 minutes, breathing in and breathe out. Breathe in and breathe out. That also helps. Taking walks help. Now, for someone like me, I'm not too keen about walk, but I do have I have an elliptical at home that I use. So it's good to take some walks. Now, what are the things that we're going to talk about? People say, well, what is the role of internet in this? Can our kids be on the internet while they're going through all this? Now, there's nothing wrong with the internet, y'all. There's nothing wrong. This is the age of technology. And assuming that people, trying to tell your kids not to be on it is like, that's a losing battle right there. But you still have to monitor it if we're talking about kids here. As an adult, you're an adult, so when you know that you're in a space that is not healthy for you, to back out of it. So because you're an adult. So being on the internet is nothing wrong with it, because you can also use the internet to find other people that are dealing with the same situation that you're dealing with. All right. So treatment, CBT, going to psychotherapy, and just having therapy about how to cope with stress. It's very important. And then, of course, there are some medications that, I don't want to suggest any medication here, but antidepressants are very good with conversion. And it's not necessarily that it's hitting conversion, but it's hitting the symptoms that come out of conversion. For example, like anxiety, like panic disorder, all those things, your antidepressant really kind of tones it down. And when your anxiety is down, your depression is down, your panic is down, and your stress level is down, then you will not have as much episode or any episode at all. Until next time, be inspired, be motivated, be of sentimental value. Understand that you are the hero in your life story. Do not allow anybody to rewrite your story. My name again is Dr. Princess Fumi Stephanie Hancock, board certified mental health doctor of nurse practice. Thank you so much. Bye-bye now.